This is something very worrisome. We're stretched thin, almost constantly.
Quebec emergency occupancy rates are at over 100%, with hospitals like the Montreal General here at 181% by noon Wednesday. Patient rights advocates and health workers say the situation is at risk of getting worse amid the summer months.
And staff tell us, they say we're in over our heads. We cannot care adequately for patients when we have double the patients that we should have on a daily basis.
As health workers in the province go on summer holidays, the lack of staffing, already alarmingly high, is pushed to another level.
We see diminished care in the hospitals because beds are closed. And what happens there? Well, it flows back, kind of the overflows in ER when we don't have enough beds in the hospital.
As of 2 p.m. Wednesday, the number of people in Montreal emergency rooms was close to 1,200, with over 240 individuals waiting to see a doctor, according to the Health Index. And by 4 p.m., the average occupancy rate in Montreal hit 122%.
That's just outright dangerous for patients to see numbers like that.
We continue to lack resources, and we continue to be in a very precarious situation in providing proper care to meet the citizens' needs, and we need to do better.
With a lack of general practitioners and available clinics that patients can turn to in the province, both Nurse Bouleris and Dr. Morris say something needs to be done urgently, or those most vulnerable will be the most impacted.
The very nature of the emergency room is to take care of those patients that show up, that have an acute illness and that need to be assessed quickly and taken care of. Unfortunately, in the sea of lots of patients, overcrowding, patients that should be in a hospital bed but are stuck in ER, and other patients that come in that don't have anywhere else to go, some of those patients kind of, get lost.
Health Minister Christian Dubé has continued to encourage Quebecers to use 811, which includes Info Santé, a pediatric service, and the primary care access point for non-urgent health issues instead of making the trip to the ER, something Paul Brunet, the chair of the Quebec Council for the Protection of Patients, says is another example of a failing system.
Imagine the health minister tells us, don't go to the hospital, we cannot serve you. I mean, you would put that in a movie and people wouldn't believe that it happens for real, but it is real. That's unfortunate.
In Montreal, Felisha Adam, City News.